Here is another video in my journal of the brain surgery for Meniere's disease called vestibular nerve section. I am updating you kind of on a day-to-day basis. Everybody's different and everybody heals differently. So I don't really talk about, like, I haven't even thought about what happened. And I mean, I have to like a little extent, but I've really pushed it out of myself because I have to cope with hard stuff. But like, there was the first night in the ICU, I said to the nurse, "This is so hard." I didn't have a good nurse. It was so hard. I read a post my mom posted on social media, and she said, like, Kelly's out of surgery, she's in recovery, and it feels like she's been in recovery longer than was in the surgery. I was vomiting from the moment I woke up. Like, the first memory I have in recovery is vomiting. That's actually the only memory I have is vomiting. I vomited all through recovery. I vomited in the ICU the whole time. I don't really know when I stopped vomiting. I didn't. I vomited right after the doctor told me he was going to discharge me, and we were scared. Like, I vomited so much. We were scared that he was going to say that I couldn't go home. And then I vomited like all night, all morning. Like, I did go home and I vomited all night, all morning. But he said basically the vomiting's a part of it because the vertigo. It's what's so messed up about this whole thing is, like, it's so much harder than I thought. I haven't looked at my incision yet. Like, it starts down here. I'm touching it right here. And then it goes up here. I had no clue it was going to be that big. It hurts so much right now. And I took medication. Actually, the medication may not have kicked in yet. They don't give you enough medication to actually, like, make the pain go away because they don't want you to sleep. They want you to be awake so that your brain can compensate for the vertigo, which is, like, doesn't make sense to me because it takes weeks and weeks. Like, with the gentamicin last time, it took me 6 weeks to compensate. So why not, like, give me a break the first couple weeks when things are rough anyway? I am forcing myself to be as physically active as I can because I'm losing strength. I remember being in the ICU and my mom or like the nurse or somebody asking a question, and I was doing this. My mom doesn't know that that's sign language for yes, and obviously the nurse doesn't know either. And I remember thinking, this is so hard. Why can't I say the word yes? Like, why is moving my hand like this work, but me saying yes is not? I couldn't keep my eyes open until the day that they discharged me. Like, I wasn't able to keep my eyes open because my brain was very active. I was thinking. It was just that I couldn't talk. I was thinking all the time. I was awake all the time. There's some reason I needed to talk to my dad, like, directly because something was wrong with the AC in my house, and so I needed to explain it because telling my mom to tell my dad was like telephone, right? So I remember I told my dad, and he was like, "You're talking." And I remember thinking, duh. Like, why is this such a big deal? I don't think, like, I knew it was really hard to talk, but I don't think I was, like, aware of how it came across to other people because I was so active in my brain. I was thinking all the time. I was telling myself stories. I wrote a freaking book in my head. Like, I remember a good part of it. So I couldn't sleep. The pain and the vertigo were so bad. I couldn't sleep for days and days. And then the vertigo the vomiting was so bad. The nausea was so bad. When I came out of surgery, I was on a Foley catheter. And then I remember telling the nurse that it pinched and I had to pee, and she took it out, and she shouldn't have because of the anesthesia. I couldn't pee, and they gave me this like temporary, like, it's called a Pure Wick, and it's like supposed to catch your urine if you're a female, suck it away or whatever. I could not pee. Like, it was over 24 hours I had that there, and I couldn't pee, and they kept ultrasounding my abdomen to see how much urine I had in my bladder. And then they straight catheterized me, which I do remember, but it wasn't that bad. And then I remember the nurse that told me, he was like, I'm sorry, but your bladder's so full, we're gonna have to put the Foley back in. And I was so upset, but they said that straight cath, that's high risk of infection because it could introduce bacteria. But it wasn't as bad as I thought. I mean, considering everything. We left it in for a while, and I'm glad we did, because when we finally took it out, they said it was gonna, like, usually people who have had catheters in have a harder time urinating. But the first time I tried, like, I went. And I remember, like, my mom had just gone behind the curtain. It was just me sitting on the portable commode. And I remember screaming, like, not screaming, but being like, Mom, guess what I'm doing? Like, it's so funny that peeing is a big deal. Like, one of the strongest memories that I have is of my dad. Like, it's like the first memory that I have of, like, a person looking at me. I know my mom had to have done this too, but all I remember is my dad's face and him holding my hands. And, like, how much that meant to me. Like, he did it briefly. He did it because he was leaving and I couldn't get up. I was laying on my left side. Like, I laid on my left side almost the entire hospital stay. Because I didn't want to move, because I was going to, if I moved, I vomited. And also my incision, is on my right. Always ask what they're putting in your IV. Always. The very first ICU nurse that I had made a huge flip up. I can't take prednisone or Decadron. And she was about to put something in my IV. I asked her, and she said, I'm going to give you Decadron or dexamethasone or whatever. And I was like, oh my gosh. Like, I literally put my hand down on hers and said, stop. Don't. I can't. I'm allergic. She somehow got distracted and entered in. I don't know when she entered it in. She gave me an antibiotic, but she also entered in that she gave me that steroid. I didn't know that at the time. So in the middle of the night, when the second ICU nurse was in there, she was giving me IVs, and just like, I can't barely talk, right? Like, I could barely say yes earlier that day. And I asked her what it was, and she told me Decadron or dexamethasone again. And I again said, no, stop. You can't give that to me. However, I could communicate at the time. And I said, I'm allergic. And she looked up, and sure as, it was there. She called the on-call doctor. Like, it was like whatever AM in the morning. It was in the middle of the night. It was dark. And I remember the doctor saying, why does it say that she gave it to her at 6 p.m. or 6:30 or whatever? And I said I stopped her. And so they decided not to give me any steroids. I have been able to take, like, methylprednisolone, which is Medrol, a steroid dose pack. I've been able to take that successfully. But the others I can't, but they just didn't want to, like, risk it. So they didn't give me a steroid, which would have helped with my pain. And, the swelling post-surgery is another sucky thing. I couldn't have that. I couldn't have a lot of things. I couldn't have a lot of antiemetics. Like, I had to have this terrible one that is only an IM injection, and it's super painful, and it's a huge dose. So they're giving it to me in my leg. First they gave it to me on my arm. It was so painful I wouldn't let them do it again. They gave it my hip, and then they were giving my legs, my thighs. Which, of course, like, everybody knows who watches my YouTube. I have tons of scar tissue in my thighs from all the IM injections. So, like, it's the last place I want anything. So it was, like, painful. Also got heparin in my abdomen a ton of times. So, like, really risked up from that. They didn't want me to get blood clots. They would refuse to use my port in the surgery. They felt like they would have more control over an external IV line. So I had one IV line going into the operating room. Then while I was under, they gave me an arterial line, which was freaking painful. when I woke up. And I'm not even going to talk about the nurses did with drawing blood. I will talk about that another time. And then I had another IV in this hand. So I had one in my left arm, and then I had a tear line in my left arm, and then I had another IV on here, which when they finally took it out, it had clots on the end. It was so painful. So finally, like, I don't know how many days in, like at least 3 days in, my mom was just pushing the nurse, and she asked every single nurse. And this nurse finally did something about it, getting my port accessed. And I got my port accessed, and everything else was a breeze that I had to go on IV. And I wasn't able to take anything orally for the first few days. So there's that. I'm a warrior. Like, I've been through a lot. I've been through so much. Like, I know that what I'm going through right now on Wednesday, June 7th, is nothing compared to what I was going through in the hospital. It's just really hard. It's hard because I can't get up. I can't do anything. And it's hard to read. Like, I was trying to read the ingredients on this thing, and I was like, I can't read it. I lost 5.5 pounds in a week from the day of surgery till a week later when I got home. And then I couldn't stop vomiting. And then I tried applesauce, and then thankfully that stayed down. That like led to other things. So thankfully I stopped vomiting, but I was still retching. I'm so proud of myself. Like, now I'm feeding the dogs. It's not accurate, and I'm missing the bowl because I'm pouring food out of like a pitcher onto the food bowl on the floor. But at least like I'm feeding them now. I've done 2 dinners, and this morning I did like heat up a fruit cobbler I had gotten from Paleo on the Go. I realized that I probably shouldn't have tried to open the freezer because I'm not supposed to do anything where I have to bear down, and I didn't realize till after I opened the door that I bared down to open a door. And then like as I was getting the thing out of the oven, I was like, whoa, I'm not safe to handle something this hot. The cobbler wasn't even heated up. It was just defrosted because it had come from the freezer. So I was able to eat it, but like it wasn't heated up. The pan was. I had to get a hold of the pan. It would have been like if the cobbler had fallen off on me or something, but it wouldn't hurt me because it was so cold still. Refrigerator cold. I ate the whole thing too. What I really want is something different than chicken and mashed potatoes or chicken and noodles. Oh, I ate red pepper, bell pepper for dinner with chicken and noodles and mashed potatoes. This hurts the neck, like the tubing, my neck, like the incision is not like I've been putting antibiotic ointment on it. I don't know. I've been trying to walk with the walker. I tried to push myself and walk a little bit more in the kitchen than I have been. Walked like to the front door and back just to like be walking more than I am. It's super hard though because the vertigo is so bad. It's just not so safe, but like physically I need to be doing it. I'm doing all my exercises in bed, but that's not getting me like physically up. I do sit up in bed. I do sit up like propped up. I actually laid down like here like this because I was exercising and my vertigo. Super proud of myself for how I've gone through this whole thing. My hearing is down. I don't hear a lot of what my mom says, and she doesn't understand a lot of what I say, so I'm wondering if like maybe my words have been, like if I'm talking too quietly or maybe my words are just garbled. I think my hearing is going to come back. I think it's just inflammation right now because the nerve was cut next to it. If I lost some hearing, it'll be fine. We'll deal with it. But I'm not worried about it yet. I'm never going to be worried about it. Like I'm not like concerned about it. I just don't like it. It's hard. It's an adjustment. The level that it is, I would definitely need to be aided. It's an effort to figure out, like I have to think about putting one foot in front of the other. My core is like nothing, which I'm trying to get my core stronger. I'm just wobbly everywhere. I feel like this is my takeoff moment. All this stuff is gonna improve and then I'm just gonna like fly. I'm just gonna keep running and just fly. And just keep getting stronger. I'm gonna go to a gym or there's like a bar class around here. I mean, who knows what my balance will be like, but I'm gonna do it. I'm very vertiginous because I keep trying to look at the camera. This is looking better. It's less bruised. I have to get it like flushed after a month of unuse. So to like make sure that a month after I was in the hospital that I have to get it flushed. And my mom was like, well, do you want to go back to IV infusions then? And I was like, I don't know how I'm going to be a month out. It looks like almost like this is a flower. Maybe I should buy a flower and just like put it there. Like buy it like on Michael's or something. Maybe Walmart. Some craft store. Make it prettier than what it is. I am Kelly. Remember, you are not alone. Live incredible anyway. Bye, guys.
You are not alone in this world. You are not